after months of the number of coronavirus cases really spreading worldwide, many folks are wondering, where is the cure?
Yeah, so here to talk more about treatments is Dr. David Battinelli, Chief of Medicine at Northwell Health. Good morning to you, and thanks for joining us this morning.
Morning.
Hey, so let's get right to this one. During a White House coronavirus briefing, right, the president mentioned an old anti-malaria drug which had been promising in treating COVID-19. A lot of people heard that and they got very excited about it. What's the chatter now among medical professionals about this?
So I think you're talking about chloroquine, and it is a longstanding old anti-malaria drug. But the reports in terms of the efficacy of that are really anecdotal, not really true. It makes a little bit of sense, but we don't really have a lot of data yet. We're waiting for good clinical trials to make these types of decisions.
Doctor, we were speaking earlier. I have taken that drug on some of my humanitarian aid trips to Southeast Asia, and it's a difficult drug. I called it Malaria Mondays because you had to take it once a week, and once you did not feel well for quite a bit of time. So there are some side effects if this drug is something that people are going to be using.
Yeah, absolutely. There's some central nervous system side effects, muscular side effects. There's some eye side effects. The drug's been used at low doses to treat rheumatoid arthritis in the past, mild lupus, but it's not clear what drug for COVID-19 right now.
So we've heard about, combining that with antibiotics, something like a Z-Pack, right? So I want to talk specifically about a Z-Pack, which is used to treat a whole host of things. And other people I've seen on social media talked about how one thing I saw was somebody had lupus and that there was lupus medication, right? And now that was being used to treat it, and they can't get their own prescriptions. So when you take something like a Z-Pack and you use it for this, are you lessening the impact it has on people who actually need it for their everyday sickness?
Yeah, a Z-Pack or azithromycin isn't a lupus medicine. It's a common antibiotic. So indiscriminately using too many antibiotics just results in different types of bacteria that are resistant to antibiotics. So that we wouldn't recommend.
All right. Many people are hearing this and trying to get their hands on all kinds of medication and treatments. What do you advise here? What are some of the pitfalls if someone tries to do this on their own?
Well, again, not proven. Overdose on some medication. They'll run on some of them. I think the best thing to do is to make sure that you're just going with the advice on isolating and taking whatever your doctor tells you that you should be doing.
Right, that's what I was getting at, saying like if you take that Z-Pack or you take somebody else's lupus medicine, you're taking it away from what people actually need. I want to quickly pivot to medical supplies right now, for Northwell Health and how you're doing. We heard from the governor this is a dire situation, that many hospitals are days, if not a week away from running out of supplies. How are you doing?
I think we're doing okay. We've been prepping for this since mid-January. We have reasonable stockpiles, but I think we're all very, very concerned that if, in fact, the surges like had been seen in Italy and in China, we could all be short of supplies.
I want to get your reaction because the president spoke during a White House coronavirus press conference last night talking about he may, after this 15-day period, start the economy back up again, get businesses running. How does that really coincide with what you're trying to do in the medical community, and that is stop the spread of this?
Yeah, I think that, to me, that seems premature. This is not clear when we're going to be, when the data says that the peak's there, then I think we can start making different plans. We're not near that yet. There's no question we're not near that yet.
So Dr. Battinelli, just for people who are tuning in right now and saying, okay, I'm hearing a lot about chloroquine, excuse me if I'm pronouncing it wrong, Z-Packs, malaria drugs. There is no evidence that any of that is actually working, and we're not any closer yet to a cure.
No, we're not. We do have some trials going on within our institution and others with medications that are in real clinical trials. We do not have chloroquine in a clinical trial right now. We have a few other medications. And there are some anecdotal but early results that seem promising.
Okay, good.
Right,
Dr. Battinelli, these things take time.
They do, and it seems like we're not even at our peak just yet. We do appreciate your time and all the hard work that you're doing. Thank you.
8:42.